The shutdown of the economy since mid-March in Massachusetts has meant kids are doing remote learning and parents are working from home or are perhaps unemployed. The situation has no doubt led to stress, anxiety, and even depression for some. Dr. Stuart Anfang, a psychiatrist at Baystate Medical Center, joined me to talk about focusing on mental health in the midst of this illness.
Well, what I would say is obviously we've been in this situation now for more than 2 months now. I think in the first month or so, when everybody was still caught up in kind of the acuity and the newness of this, I think people were doing pretty well. You know, they were dealing with the hunkering down and the shelter in place and kind of the changes to their routine and changes to their access and treatment. And I think people, from a psychiatric perspective, were actually doing quite well with that sort of initial surge and the initial experience. I think what we've noticed now over the last several weeks, as that initial crisis has perhaps settled, and now people are in for a sort of a longer haul. What does it mean? How long is this going to go on? What is going to be the enduring impact for my life and for my work? I think people are finding it harder to shelter in place. Obviously, the weather is getting nicer. So I think now that the stresses of the quarantine and the stresses as to how it's kind of reshaping our lives, now that's beginning to play out more. So I think over the last several weeks, we're beginning to see probably an increase in terms of people's anxiety and depression and coping strategies dealing with COVID.
And obviously, you know, the goal is to protect people's physical health, but that mental health component is certainly a big one. And obviously, there could be some long-term effects to that.
Yes, and I think people are concerned about that and anticipating that there's going to be, as people begin to be able to go out and access treatment, that there will need to be treatment available for people, but also treatment may be done in a somewhat different way. So there's much less in the outpatient realm of face-to-face treatment now. A lot of people are getting treatment virtually via video, via phone. You know, obviously COVID is a present factor for things like day programs, partial hospital programs, inpatient programs. And so both treaters, both providers and patients are really beginning to explore what is so-called the new normal in terms of accessing treatment and accessing care.
What kind of impact do you think this will have on suicide rates? I know a lot of people are concerned about that. There's been some high-profile cases, including the doctor from New York City who took her life in the midst of all this. What are you hearing about that?
Well, so there is, you know, multiple points of very stressful situations. The doctor and healthcare providers are obviously a key area of stress, people kind of coping with the difficulties of working under very challenging circumstances. I can tell you that at Baystate, we've had a program now for pretty much the duration of the crisis, of really outreach to our providers, a lot of emphasis on psychological first aid, on debriefing, on making accessible supports and resources to the frontline caregivers. And that's going on all across the nation. Hopefully, I think as health systems have become less overwhelmed with sort of the acuity of not enough ventilators, things like that, the instances of, for example, that caregiver in New York, you know, that we should see sort of less and less. Now I think we're beginning to see more the stress of dealing with the economic challenges. I think people are finding it challenging to be at home, sheltering in place, being with their family. You know, people are finding that is stressful for family relations. There's an increase in substance use. There's an increase in domestic violence as sort of the challenges of people being sort of stuck together for a longer period of time than they're accustomed to. And so we're seeing more depression and regrettably more self-injury and suicide.
And when you talked about some of the financial problems that people are facing, back in 2008, a study was done after that by the British Medical Journal that did see a spike in suicide as well. That stress of not knowing when the next check is coming in, if there's a check coming in, and how you're putting food on the table just has such a profound impact on so many people.
Yes, absolutely. And so, there was obviously a lot of efforts in the beginning from the government and other resources to provide a safety net for people for the acute economic shock. But obviously, we'll see what happens as things continue to go. What is the economy going to look like? What are job opportunities going to look like? What are going to be the financial supports available? It seems like there were a number of things that were done in the short term, and now we're going to see what things are like in the longer term. One of the particular challenges in healthcare in general is, and you've probably seen this, that even though hospitals are busy with COVID patients and managing that, the sort of normal operations of hospitals have been suspended. So elective surgeries, elective procedures, all the other medical care has basically been suspended. And that has put healthcare providers and hospitals and behavioral health providers under a tremendous amount of financial pressure. And so the question is going to be, as things evolve, what is it going to mean for hospital and healthcare providers in terms of being able to be accessible and being able to provide the services that people will need?
And as we reopen, and you had mentioned a little bit that the weather has been getting better, which I do think is helpful for moods in general. But what do you see sort of as the way forward as far as helping people? You had mentioned substance abuse, domestic violence, and really letting people know that there are services out there.
So the first thing to recognize is, although it's a truism, we are all in this together and everybody's experiencing that frustration. The second thing is that things do seem to be getting better. Right. So there seems to be some easing up in Massachusetts and in other states. Things are gradually beginning to return to a new reality, not quite what we had before COVID. But obviously life is beginning to come out and people are beginning to settle into a new routine. So recognize that we are all experiencing this together. However, if you're finding that substance use is becoming an issue, your frustration tolerance is less, there's issues of fighting at home, you're having symptoms of significant depression or anxiety that's really impeding your function, those would be the warning signs to reach out to your primary care provider and get some help.